Okay, so can you give me your identification? I mean, from which country you are, your name, your academic qualification, so that we can all understand why this meeting today.
Okay, so my name, I don't know if you can see my video. There's no light here. I apologize for that.
No problem. Audio is fine, no problem.
My name is Dr. Baswan F.A. I'm a pediatric resident. I'm going towards my third year now. And I got
Wait, let me mute. Everyone, I'm requesting, please mute all the mics. And yes, Dr. Rikezi, please open your mic again. Sorry for this.
Okay, thank you. I got to know about the Mrcpch, and a friend of mine that participated in your class. Yes. She said she did very well, and I also was inspired to take the exam. Okay. So I told my friends about it, and they are equally happy to know about the exam. So that is why we say, okay, we better contact who has more experience than all of us and may be able to help us. Yes, ma'am.
Yes, yes. Thank you very much for contacting me. Yes, I'm always ready to help. If any group of students, actually, they want to join my classes or they want to learn from me, I always welcome them. This is a big opportunity. I find myself as blessed that I'm conducting these sessions. And today I was free, so I thought that why not? It will be beneficial if I give something important to talk. Okay, so anyone has any questions? Anyone has any questions before I start? This is a part 1 orientation station, Mrcpch. Okay. Yes.
Good evening. Can I send them the link to join this class, or we continue,
please.
or you?
Yes, please. You send them the link. Yeah.
Okay, I will send them the link straight away. Thank you very much. We're grateful. Yeah.
Okay, so shall we start? Okay. Okay, thank you for giving me this opportunity, actually. And today we gathered here for Mrcpch part 1 orientation. And as you all know me here who joined, so you all know me by this time. I'm Dr. Tamanna, one of the pediatrician in Bangladesh. Recently, I have joined in UK as a pediatrician. And I have been long time doing these sessions for, I think, almost 3 years now. Just 1 minute, there is some technical problem. Okay. So I guess you can see the screen here. Can anyone respond? Is the screen is okay?
Yes, we're able to see the screen, ma. Thank you.
Okay, okay. So this is me. Today we were discussing about what is Mrcpch and what is the prospects of Mrcpch, why we will choose this degree. From all over the country, people are choosing this degree. So why? This is our discussion today. What is the benefit of doing this much hard study? Okay. So number one, many countries in the world, they do not have a recognized pediatric qualification or pediatric degree. Like in UK, there is PLAB. After that, we give Mrcpch in pediatrics. And in many other countries, there is masters. We call it MD, masters in medicine, masters in pediatrics. And in Bangladesh, Pakistan, we have FCPS, fellowship in pediatrics. And in many countries, there are fellowship. But Mrcpch is such a prestigious degree that you can get this degree sitting at home. Most of the parts are theory parts are now conducting these theory parts in the online exam. So before COVID, it was like only 10 to 12 countries in the world. You have to travel and you have to go to that country and you have to give the exam. This was before 2019. I'm talking about before 2019. After 2019, when the COVID strikes in 2020, that time the Mrcpch started taking exam online. And now the theory parts you can give from all over the world, okay, theory parts. If not in your country, then you can go your neighbor country to give the theory exam. And theory exam passing is very easy. And if you have a little bit of tricks and knowledge, of course, you need, but suppose you have a little bit of tricks, then you will easily pass this exam. In last 3 years, when I am in the teaching profession of this Mrcpch, I have seen many students who just follow the protocol, who just followed the protocol and who just followed the, criteria of the question and answer, they passed easily. Because every country exam has a system, okay? You will understand when you give exam to your country, there is a system. Suppose I passed FCPS from Bangladesh, then I passed DCH. So this is a systematic exam. I know the question pattern. When I passed Mrcpch, I know the question pattern, okay? So Mrcpch, before sitting the exam, remember, knowledge is important, of course. But before knowledge, another thing is most important, that is technique, or you can say tactic. What are those tactic? Today we will discuss what are those technique that is important to pass Mrcpch exam. Okay, so before starting, there is some general knowledge, like theory part, there is no training required. Even in the clinical part, there is no training required. But there is a but. What is that but? In the clinical part, you need a supervisor, okay? That will be your clinical supervisor. Not necessarily he has to have Mrcpch, not necessarily, but yeah, you need a supervisor. And that supervisor will be questioned if you do very bad in the exam, that you are giving reference to a student that is not at all qualified for the clinical part. So what I will suggest, take some training for your home country. Not necessarily it will be UK training. It should be your home country. You will take training from your country, like 1 year, 1.5 years. It is written in the Mrcpch website that 2.5 year training is recommended, but it is not mandatory. You got my point? So 2.5 year training is advised, but it is not mandatory. I know many students who passed Mrcpch even without 6 months of training, but their knowledge is very good. They did clinical, they did internship in a good, very good hospital. They know that they have the grip of clinical knowledge. They can pass, but don't go in that boat, okay? You remain on your boat, that is, you need some training in the clinical part. So my advice is, after doing your internship, after completing your MBBS, you directly join to the pediatric hospital, any pediatric hospital that is present in your home country. Okay, this is my advice or my suggestion as a senior of you. So when you pass theory exam, you have to wait for few years. Now, this is a bit tricky part. Suppose you are a UK trainee, you are ST3 or ST4 trainee, you already passed PLAB, you already are doing job for last 2-3 years in UK, and now you are ST3 or ST4. Mrcpch will give you the priority because you are in the career critical stage. You need to go forward after this Mrcpch. So you will pass easily, you will easily get a seat in UK. Suppose you are from Ireland, okay, or from Wales, or from Scotland, that is around the UK country, and you are doing training or you are doing some non-training job, but you need to fill up, you need to go in training for ST4, you need to pass this exam, then you will also get the seat easily. So these are the people who are the topmost priority to get the seats. Even after, I know many my students passed, even after 6 months of passing the theory exam. My students already passed because they are UK trainees, okay? They are the exceptional people, okay? For you who are like India, Pakistan, India, not Pakistan, India, Saudi Arab, they have seat. They have their clinical seats, okay? So when you apply from India or from Oman or from Saudi Arab, you are the resident of that country. What will happen? They will give you seat according to your seniority. Like you passed Mrcpch last theory exam in which year? They will give priority to the seniors. In which year you passed all the theory exam for PENTAS and AKP. Okay, they will give you priority. Suppose there is no student senior, all are junior. Yes, all will get the seat. All will get the seat because you are the juniors, but there is no Indian and there is no Oman or Saudi Arab people. So you all will get the seat. Suppose there is no Indian, no Saudi Arab people, only people from Bangladesh, only people from Pakistan, Sri Lanka, then they will give the seat to those overseas people. Okay, so remember, the people who does not have center, like Bangladesh, like Nigeria, like Ghana, they do not have center. So they will get seat after those people who are in the center country. And giving exam, getting a seat in UK is very tough because they have their own trainee, own employee. Clear? That's why clinical part is a bit lengthy waiting, 2 years almost. But this 2 year you need, you can ask me why I need 2 year, I'm very good clinician. No, this 2 year you will do the training, you will read, you will gain the knowledge, okay? And also you will do some quality improvement project, you will do some audit, because after passing Mrcpch, when you apply for jobs, they will ask you, do you have any quality improvement project? Do you have any audit? You will say no. That time you will fall down. In interview, you will fall down. The people who have this quality improvement, who have a journal publication article, they will go up. Even if you have Mrcpch, they will go up. So this 2 year, you will not only read clinical part, you will also do some thesis, some journal, some article publication, some audit, some quality improvement, okay? That's why this 2 year in the clinical part is very important for your life, for your future career. Your pediatric consultant can become your referee. Not necessarily he has to be Mrcpch holder, not necessarily. Your consultant is enough. Now, you can ask me how I will get GMC registration. There are 3-4 pathway, okay? Number 1 is PLAB. You know, part 1, part 2. Before part 1, you have to give OET, English test. These are the pathway, easy pathway. PLAB is the very easy pathway, beginner pathway. After MBBS, you can choose PLAB. But remember, even after you pass PLAB, you have to pass Mrcpch if you want to take training in pediatrics in UK. Then you have to pass Mrcpch in UK. That is very difficult because why? Because in UK, the life is very busy. You will be very busy. You do not have any time. So in home country, we have time, we have support. We don't have any financial problem at all. Maybe mild financial problem. So remember, even if you pass PLAB, you have to pass Mrcpch later on. But from the home country, if you go passing the Mrcpch, you do not need any more study. Study is finished. Clear? So that is the benefit of Mrcpch. But yes, PLAB has 2 part, Mrcpch has 3 part. PLAB need less money, Mrcpch need more money. For giving exam, 3-part exam needs more money. And PLAB preparation is easy, Mrcpch preparation is difficult, right? So there are many drawbacks. I'm not going in that detail. There are some other routes like MTI, sponsorship, fellowship, but these are a bit complex discussion. I'll not do that discussion. Maybe we can do that discussion later on. But today we will focus on Mrcpch, okay? And Arab country, remember, if you have a training in UK, like 1 or 2 year, you passed Mrcpch, and then you can go to UK, and then you can go to Arab countries with a very good salary. Even if you don't have any any UK experience, but if you have Mrcpch, you can go to Gulf countries with a high salary. Okay, so this is the benefit of Mrcpch. And in Australia also, they take it as a specialist degree. Okay, Mrcpch is recognized as a specialist degree. So many countries I know, they recognized Mrcpch. Okay, in this slide, do you have any question? Yeah, you can ask me. This will be very good discussion then. You can ask me any question if you have.
Okay. Doctor, thank you very much. We are grateful for the introduction. My question is, if one is already in training here and they have done some clinicals, does he still have to wait for so long to get a space for clinical exam for the Mrcpch?
Yeah, if your country does not have center, you have to wait. Even if you have any clinical experience, how much clinical experience you have, but the waiting time is similar for all. Your seniority means your passing of theory exam, not your age, not your experience. Okay?
Okay, thank you very much.
Yeah.
Then
Dr. Saddam Hussein is asking, do we need any UK experience to work as a specialist in Australia or any other country? Actually, I'm not discussing today the Australia pathway. Okay, that will be very complex discussion. So you have to see the Australian website, AFRA website for that, okay? And I am having FCPS training completed, but not taking my exam. Yeah, FCPS training is not mandatory for Mrcpch. You can give Mrcpch even without FCPS training. Okay, is that your answer, Dr. Saddam? Yeah. You can ask me also opening the mic, okay? What is the advantage of passing DCH exam over? Yes, DCH is also recognized Mrcpch degree. Okay, but DCH currently will not give you GMC registration. But suppose you passed PLAB or you passed DCH or you joined some other pathway like fellowship or MTI, then definitely this DCH will give you a highest value because this is a UK degree. DCH is also a UK degree, diploma, Mrcpch degree. So definitely, if 3 people give the interview, they will pick you because you have an additional degree. You got my point? This is an additional benefit. Like quality improvement, like research, that are not mandatory, but that are additional improvement in your CV. Okay. So this is the main topic of today, our part 1 Mrcpch discussion. So you all know Mrcpch part 1 consists of 2 parts of exam, that is TAS and FOP. TAS exam and FOP exam you have to pass separately. Remember, separately. What is the pass mark? Pass mark is not fixed, it is variable. In some time it is 55, in some time it is 75. Why? Suppose the question is very hard. Maximum student failed, got below 60%. That time the pass mark will be 55. But suppose question is very easy. Question is very easy. Most of the student got 75 up. Then the pass mark will be cut off 75. So it is a graph. It is a graph. So what is the maximum student? In which number the maximum student? Here is the maximum student. So this is 60%. So the pass mark will be 60%. Is it clear? Pass mark to everyone? Is it clear?
Yes.
Yes, you understood pass mark, right? So pass mark is not fixed, it is variable. And you have to actually prepare yourself for the exam. Don't worry about pass or fail. Just prepare yourself for the exam. Okay. Question, how many questions will be in the TAS and will be in the FOP? It is also variable, like from 90 to 100. Total question should be 90 to 100. How many hour? 2.5 hours. 2.5 hours. So how many minutes? 2.5 hours. 150 minutes. right? 150 minutes, you have to answer almost 100 questions. So one question is around 1.5 minutes, and that is very tough. That is very, very tough. Trust me, time management is very tough. Okay, one doctor is asking me, how about the age? Any age limitation? No. Fortunately, there is no age limitation for Mrcpch exam. You can sit at the age of 25, because in my batch, I have one 25-year student, one not, two, three 25-year student. And in my batch, there is 58-year student. So there is no age limit. Got it? Okay. So there are two papers, TAS and FOP. You have to pass separately. Pass mark varies. Question is varying. Question is 90 to 100. Okay. And 2.5 hour TAS and FOP. But there will be a little gap, like 30-minute, 40-minute gap for, refreshment, using toilet, washroom, and water, something that is for 40 to 45 minutes. So this is for TAS and FOP, in between TAS and FOP. Okay. Same day, exam will be same day. Morning is TAS and evening is FOP, or morning is FOP, evening is TAS, same day. And remember, you can give only TAS or only FOP. This is the benefit of part 1. In AKP, no. Paper 1, paper 2, same day, you have to give same day. But in part 1, TAS and FOP, you can give one by one. Like, suppose this month I will give TAS. Next, after 3 months, I will give FOP. So this you can do. But in AKP, that is part 2, or clinical, you can't do this. You cannot fraction your exam. Only in part 1, you can fraction your exam, because you have to pass separately. There are 3 sessions per year, like February, June, and October. So you have to book your exam when the window is open. What is window? I will tell you later what is window. Okay, but remember, these are the 3 exam time when you give your exam. But the preparation, you should start from now. Suppose you are giving exam in next year June or next year February, your preparation should be started from now, because it is not at all an exam of 1 month. You cannot book exam and pass exam in 1 month. It is not possible, because booking exam is 2 months before. You cannot plan to give this exam within 1 month. You got my point? Booking exam is 2 months before. That means you have to plan your exam 2 months before. Okay? There are 2 types of questions, single-based answer and extended matching question. What is that? Single-based answer means there is a question and there are 5 answers, 1, 2, 3, 4, 5, A, B, C, D, E. So you have to correct one, either one. This is called single-based question or single-based answer. What is multiple or EMQ? EMQ means, suppose question number 3, it has 3 questions, question A, question B, question C. And there will be 12 answers. So in this 12 answer, question A is answer, suppose 4, question B answer number 2, question C answer number 3, suppose like this. So from this 12 answer, 1 answer is correct for every question. Now this 1 answer can be separate or can be answer number 2 here, answer number 2 here, possible. Same answer, 2 question, possible. Okay, is that clear? What is EMQ, extended matching question, to everyone? I hope so.
Yes,
okay.
very clear.
Okay. So now online exam you are giving, but as soon as Mrcpch decide, this online exam will be stopped. So by then you have to go to another country to give the exam if your country does not have any center. Okay. And fees, what is the fee? This is given in the Mrcpch website. I think something like 353 or something like that. Okay, both paper is around 600 pound, both the paper. Okay, okay, let me check the fees now for you. I'm on the website. Just 1 minute, let me check. Okay, exam fee. Yeah, if you give FOB, only FOB, so it will be 335 pound. Only task also 335. If you give both paper together, it is 565 pound. Okay, this is the fees for Mrcpch. There is no, you cannot give this fee by post or by, you have to give via credit card from bank. Okay, there is no bank draft. Previously bank draft was accepted. Now they do not accept bank draft. They only accept credit card. So UK transaction 565 both paper and 335 single paper. So this is the fee for part 1 exam. Okay, any confusion between this now?
No, it's clear.
Okay, it's clear. Yeah, that's very easy, right? Now, next slide. How to make Mrcpch account. This is very important. As I told you, this exam you cannot give by thinking today and give exam after 1 month. No, this is not such a kind of exam. This exam you have to plan years before you give, at least 1 year before you are giving the exam. Why? You have to plan your schedule. You have to plan your money. Okay, you have to plan your study leave. Okay, and then you have to book the exam 2 months before. You cannot immediately book the exam and give the exam. No, that is not so easy. Form fill up should be 2 months back. What does it mean? Making an Mrcpch account, and then it will take 10 days to activate that account. So suppose your booking is in the month of April, your booking time, not the exam time. Booking time is April 10th. You need to make Mrcpch account before April. That means on the March, your account should be complete. How your account should be complete? You will click this link. They will direct you to the page and you will make an account. You will just click make an account. And in this make an account, they will ask your biodata like name, age, date of birth, residency card, I mean, which country you are, okay, your which hospital you are working, at which level you are working. Suppose you write down that I am currently unemployed. They may not allow you to sit in the exam. So don't write I am unemployed. Write that I am doing private practice or I am seeing patient at my home. Write that you are practicing pediatrics. Even if you are sitting at home doing nothing, do not write this in the biodata. You will never get job in UK if you write this. You have to write something positive like, currently I am on maternity leave, or currently I am on sick leave, or I am doing private practice at my home country. This is the address of my private practice. Or I am seeing patient online. Anything you can write, whatever you are. Okay. So just make an account, give your biodata, and then Mrcpch will send you your account number and your password. Your account is set. Then click your account and mail Mrcpch, how can I verify my account? They may not tell you to verify your account, but you have to mail them, how can I verify my account? Any additional papers do I need to submit, like MBBS certificate? Then why? Because before exam, they may tell you that your account is not verified. So you will be in a trouble. So don't do this. After your account is made, your password is made, click the account, click the password, see that your account is ready and mail Mrcpch, how can I verify my account? Because I did not give my certificate, MBBS certificate. Because my students sometimes face this problem. Their account was ready, but when they click book exam, they said that your account is not verified. You are not eligible for exam. Then immediately they mail to the Mrcpch that why my account is not verified. I already made the account. And Mrcpch said that we need to see your MBBS. Why? So you do advance, you mail them. Do you need to verify my MBBS certificate because I did not give that till now? So they said yes. So then you verify your account. Then Mrcpch will send you one mail that yes, your account is now verified and you are ready for exam. Got my point? So your account, making an account needs at least 10 to 15 days time. So it is not an immediate action. You cannot give exam just immediately. Clear? But once you make your account, once you give exam, after that it's very, very easy. Part 2 is easy, clinical is easy. But the first beginning, anything beginning is very difficult, right? Anything you begin, that is very difficult. It is not easy to start a new job, start a new career, start a new degree. It is not easy. So, but after some time, when you pass part 1, when you pass part 2, it will be very easy, one by one, one by one. Okay. So after verification, remember your account is complete. Before verification, your account is not complete. Although you made an account, but before verification, your account is not complete. Is there any question from this slide? Shall I change?
Okay, thank you very much. So once we get the RCPCH number, it shows that the account is already verified. Is that what?
No. My students face the difficulty. Once you made Mrcpch number, that doesn't mean your account is verified.
Okay.
You have to send separate mail for verification.
Okay. Thank you.
Yeah, you are welcome. Next slide is, when your account is verified, you can book your exam. See when the window is open. What does it mean, the window? Suppose your exam is in February. So when the window will open, can anyone tell me? In February, when the window will open? In December. 2 months before the exam, your window will open. It is clearly written in the website that at which date booking will be started. This is called window. Booking of the exam is called window. Like 1 day, 2 day for Nigeria, 1 day for Bangladesh, 1 day for Pakistan, like this. This is called window. You cannot book this exam after your time is finished. Suppose your window is 10th of December. You cannot book exam after 10th of December, like 11th December, you cannot book. If you book 11th December, that is for another country. You have to come to another country for exam. Because for Nigeria, it is only 10th of December. For Bangladesh, it is only 11th of December. You got my point? This is an example. So after your window finished, you cannot book your exam. If you book, that will be in another country. You have to travel. Okay? And remember, when the window is open, within few minutes, like 2, 3, 5 minutes, all the seats are gone, vanished. Because people are waiting for this seat for a long time. So all the seats will gone. So you have to get your MasterCard ready. Not only MasterCard, your Visa card. I mean international card. It can be MasterCard, it can be Visa card, but it should be international. I mean, your bank is ready to transfer the money from your account to Mrcpch account. Call your bank. Am I supposed to give exam? Am I supposed to pay? Can I pay from my MasterCard, my Visa card? There is a cell number, call number. You can call them easily and you can talk to them. It is your bank, your country, right? So you just call the bank that I want to give exam. I want to transfer fee to UK. Can I do that? So if your bank is ready, yes, you can proceed. This is an international payment. Another is you can get ready to your friend. whoever is your friend from UK or from other country, like, European or American country, they have easy transfer. They can transfer easily. But poor countries like Bangladesh, India, Pakistan, Africans, these countries are actually not allowed to international transfer for many reasons. But developed country like UK, Canada, America, Australia, they can easily transfer money from here to there. Okay. So take help from your friend. Like even in my exam, I took help from my friend who is in Saudi Arabia. I got her card. I then paid because I could not pay by my card because it was not taking Bangladeshi card. Okay. Book as fast as you can because the seats are very limited. Even online exam seats are very limited, like 10 to 14 seat or 20 seat. It will vanish like within minutes. For any details, you just click this website, www.Rcpch account UK education career exam. This is the site. This is the site. You just click on this site and you will find all the information. Please read the information very carefully because we don't want your loss. Rcpch does not want you to become sufferer. Okay. Okay. Any more point today? Okay. Until now is clear, right, everyone? Okay. Now, okay. So many questions I get from the students, like how many times I need for preparation. Now, this is not a fixed answer. Can I give a fixed answer? You tell me, can I give a fixed answer that you need 3 months, you need 6 months? It is individualized, right? You and me are different. Your experience and my experience are different. So the time is different. Some people who are already in the post-graduation training, like UK training, or like training in any country, they are taking training, they need less time, 3 to 6 months enough for them. But some students are beginners, like an MBBS, or suppose you have 7-8 years gap, 3-4 years gap of the study. You have children, you have family problem, you have health problem, you could not study for 3 to 4 years. So those will not be similar. Am I right? So the students who are already in the training, they are every day doing study, they will take 3 to 6 months and then they can give exam. Confidently, they can sit in exam. But for the beginners, I will say 6 to 9 months. For the study gap, I will say 6 to 9 months. How many study? Daily, at least 6-7 hours study, daily, without any interruption. This is a dedicated exam. Start with a plan. Whenever you study, don't study haphazard. Start with it. Like I'm telling you, when I started my journey of Mrcpch, I made a plan for myself. This is my plan. Okay. I gave here date. I gave here date. I gave here topic. Okay. And I write here daily 6 to 8 hours study, my mandatory after my duty. Okay. I was on full-time duty. Then what I did, I wrote here that on December 10th, I will do study of cardiovascular. I started like CVS. Then December 13th, 3 days, I read CVS. From which book? I will tell you from which book. Book, I will tell you later on, okay? Material and book. Then 13th, I started CNS. Also book, I will tell you later on. Then 16th, I started musculoskeletal, like that. So I made a full slide preparation for my study. Books, materials, I will tell you later on. So this is my study plan. When I started my study, I made a plan. I did not study haphazard. But yes, someday I could not study 6 hours. Someday I studied more than 6 hours. Like I studied even 10 hours. It was Friday. I was at home. I was free. I studied 10 hours with some break in between. So the hour can be fluctuating, but remember, you should stick to your routine. You should stick to your system. Make some good friends like your batchmate, your classmate, maybe your husband, maybe your friend who is also a pediatrician. Make a partner, okay? And then not one partner, I had actually two best friends. Man, we three actually studied together. All the parts, whatever exam, all the parts we studied together. So make some good study partner, also friend, and then talk with them about the study plan, and then do meeting with them, like Zoom meeting, or if you are in the hospital, do face-to-face preparation. Like in our PG time, I prepared my FCPS with my friends, Bangladeshi friends, in the library in the Bangladesh. I had some hospital library, okay, big library. We went the library, we studied for 4 or 5 hours after hospital, then we came back home. We did lunch over the hospital, we did, tea break in the hospital. So make some friends, okay? You need friends every time. This exam, remember, passing alone is very, very difficult and painful. You will forget, no one to remind you, okay? You will not want to study, no one to push you. So passing these exams with yourself is very difficult, and don't do that. Don't isolate yourself. If you have no one, ask in any group, okay? Or join any batch, paid batch. If you have no one, join any paid batch. There will be many friends, okay? So don't study alone. This is my request. Don't study alone. Make some friends, make some group, then study, okay? Then you start with the MCQ. Why MCQ? Don't start recall. Recall is very dangerous. You will be totally confused. Start with any question bank, like there are past test question bank, there is on exam question bank. But remember, this question bank you should study from the initial period of your preparation. Later on, when you complete your preparation, you should revise recall. What is recall? Recall means last 10-year exam question. Those are recall. What is the difference between question bank and recall? Question bank is a commercial question bank that is sold by £50, £100, like that. But that is not exam question. That is just a practice question. But recall is a directly exam question and has more value, more importance. But you cannot study recall unless you have some knowledge, unless you have some idea from which book this recall came. Am I right? If you are totally blind, how you know which book contains this recall? So you have to solve recall, then your main book, that is Mrcpch book, then recall. Okay. Some people, like clinicians, they like to give AKP part 2 before part 1. Why? Because they are daily seeing the patient, daily discussing X-ray, ECG, data. So they have more knowledge in X-ray, ECG, and data. So they want to take AKP first. But my advice is always start from the beginning. Don't jump and jump. Don't run and run. Just give exam part 1, pass part 1, then give AKP, pass AKP, then give clinical. You can also give DCH after passing FOP, because FOP plus DCH clinical is another degree. FOP, Mrcpch FOP plus DCH clinical, these are another degree. This is called DCH from UK. So when you pass TAS and FOP, you can directly sit on clinical DCH. And when you pass AKP and part 1, you can directly sit on clinical Mrcpch. These are two different degree. Today my discussion is not DCH, so I'm not going in DCH. Today my discussion is FOP and TAS. Okay, so AKP you can pass before part 1. or after part 1. This is your wish. According to your knowledge, you can give. There is no waiting time. You can pass part 1, suppose in February. You can sit AKP in May, after 1 month, May. There is no waiting time for theory exam. Just book the exam, give the exam. But there is waiting time for clinical. Clinical is not your wish. It is Mrcpch wish. But theory part is your wish. When you want to give exam, you can give easily. Okay? Any question from this slide? We finished this slide. Okay, I hope it is clear for all of you. Now let us come to the books. That is the main source. Okay, the main books for FOP exam. FOP is the first exam, like in the beginning. Okay, in the morning exam, FOP. Then evening exam is TAS. So FOP books is mainly, FOP exam is mainly guideline-based exam. Okay, guideline-based, like pediatric guideline, neonatal guideline. You can ask me, what are those guidelines? Those are nice guidelines. Compiled in a book, we call it Green Book of Pediatrics, and we call Blue Book of Neonate. Green Book is the Pediatric Guideline 2022, and neonatal is the Neonatal Blue Book, that is 2021 guideline. There are some books that is published by Mrcpch. The book name is FOP TAS AKP Clinical Cases Book. There is also DCH Clinical Cases Book. So every exam in UK, there is a book that is called Cases Book, case-based. FOP has 50 cases, TAS has 50 cases. There are some questions related to ethics and palliative. When first time I give exam, part 1, I was very surprised. I was very, very surprised about ethical question, palliative question, and statistics question. You know why? I am already consultant in my country, but so nicely they are describing this ethics, palliative, and statistics. I was very much surprised because in our exam system, those topics are very negligible, ignored. Those topics are ignored. Okay, you can also share with me in your country, doctors from Nigeria, can you share from your country, ethics, palliative? Do you read these chapters very much or very little?
Hello, good evening.
Yes, good evening.
Yeah, I'm Dr. Taufik. I'm from Nigeria.
Yes.
Yeah, we take these courses. We take them very. It's a major part of our training in pediatrics. In fact, before we write our part 1 exam, that's like a membership exam, the first stage exam in the residency program for pediatrics, we have to do a course, an ethics course, which is compulsory.
Okay.
Before so we have to take ethics courses compulsory before our exam, especially by the one that is organized by the West African College of Pediatrics. The ethics program is very important, is a prerequisite to writing our part 1, which is the membership exam.
Okay.
So, and then also in our part 2, that's before you get your fellowship program, the ethics is also a major part of the syllabus that you have to cover. And for the palliative care, that part is for our national college, that's the National Postgraduate Medical College for Pediatrics. They consider this palliative care a major aspect of our syllabus.
Okay.
And then one cannot even...
Also statistics?
Yes, and also statistics, but statistics is not usually very emphasized like that in the part 1 exam. But for the part 2 exam, where you have to present a dissertation, that you have to present it, of course, you know that you can't do a research without having having a sound knowledge or being well grounded in your statistics. So there's no way you go through the residency program here in my country, particularly the part 1 and then the part 2 exams, without having a good grasp of this this
That
part.
is very good, very good. I did not know that actually Nigerian Medical Council is that much advanced. Yeah, that is very good and rewarding, of course. But in Asian countries, actually these topics are very neglected. Okay, I don't know why, but these topics should be given the maximum importance, because pain control, symptom control, palliative care, ethical cares. Nowadays, for last 5 years, it is going to be included in the syllabuses, but before that, they are so neglected topics. So remember, ethics, palliative, statistics. These are the base of Mrcpch exam. But for FOP exam, there is no statistics. You have to give ethics, palliative. Okay. Until now, any confusion of this? Now there are Mrcpch website. Okay. If you type ethical care in children, or if you type palliative care in children in the internet, they will give you a lot of data. But in our batch, actually, we made a concise notes. I used to teach from my recall experience of last 10-year exam question. So ethics palliative, we made very simple class that maybe more students, like some newcomer students, have some difficulty. But as I'm very happy to know, the Nigerian Medical Council has this much opportunity to give training about these topics. That is very good news. So for you, it will be easy, ethics palliative. But remember, every country, ethics and palliative are different. Why? Because there are some rules. You will understand when you do the recall, you will understand that there are certain rules in UK not applicable for Irish, like not applicable for Ireland. There are some other rules in Ireland not applicable for UK. Okay, so it is different. Okay, then recall, I told you last 10-year question is very important. Then I told you sample paper. What is sample paper? Any idea what is sample paper? Sample paper means Mrcpch actually release some question. That is called sample paper. These are Mrcpch question bank. And they give you this question before your exam, like 20-25 question. And we, the teachers, or we who have the groups, we can share this for all the groups, like sample paper. You will find this in my Telegram channel, in my WhatsApp channel. You will find everywhere these sample papers. Survival guide or illustrated textbook. These are not mandatory books. Not mandatory, but these are very good books for FOP exam, survival and illustrated. They are very good for AKP also. So suppose if you read these two books in the FOP, it will cover your AKP. And I am telling you, AKP preparation and FOP preparation is almost same, except ECG, chest X-ray, audiogram, EEG, data. Okay, these are CT scan, MRI. These are extra in AKP. Otherwise, FOP exam and AKP exam are almost similar. Both are clinical question, both having guideline-based question. So both are guideline-based exam. There is no theory part here. Theory part is task exam, not here. Here it is clinical question like management, investigation, what is the treatment, what is the drug of choice, what is the side effect of the drug. These are the questions for FOP and AKP. Clinical question. There is no theory. Okay. Theory is important, but mainly it is clinical. But you can compare with the task exam here. The task exam has similar question, but some chapters are extra, like basic subject, like statistics. They are not coming in FOP. Pharmacology also come in FOP also. But basic subject, statistics, and basic pharmacology will come in TAS. Suppose in TAS exam, they will give you mechanism of action. But in FOP exam, they will give you treatment. What is the drug treatment? You got my point? Or side effect, like that. But in task, they will give you mechanism of action or group of drug, which group of drug it is. This is the difference, but pharmacology is important for both FOP and task. So for task, there is task clinical cases book. There is Science of Pediatrics book, that is the vital book for my course. I have 35 to 36 hours lecture for this book. It's so vast and so big book. And 36 hours only for this book. Okay. So this is a very, very good book. You know why? Not only task, it will cover your clinical exam even. There are every single detail like investigation, treatment, every single detail. And for part 1, many students, like I'm not telling you the name, but there are some students who message me that, Madam, I have failed 5 times, 6 times in TAS. I don't know what is my problem. I pass in FOP, but why I fail in TAS? TAS is a basic exam. Why I fail? I asked them, did you read Science of Pediatrics? They said, no, madam, this is very big book. We cannot finish it. We could not complete it. And they failed multiple times. It's a waste of money, waste of time, waste of energy. I feel like that. So when I read 36 hours, when I teach them 36 hours of this book, after that, immediately they pass. After immediately the exam they gave and they passed. Because the Science of Pediatrics book has many boxes, has many questions. So nice. It is so nicely written that if you read one time, and if you read this question and box one time, and revise before your task exam, you will pass definitely. Because Mrcpch, this is a Mrcpch book. And they try to give exam question from this book. But there will be some question that is not present in any book. That question is for the scholar student. Suppose you are a very scholar, you always get 98, 99, 99, like that. You never got below 90 in your life. For those students, there will be some extracurricular question. So don't bother about those questions. Don't bother. Don't think yourself as a scholar. Think I am an average student, okay? So you will definitely pass if you read these books, but with technique. With technique. It is not so easy. Books, everyone has these books, but how many of them pass? So this is every technique you need to, like in our group, I'm giving you some example. In our group, our students, every day they are discussing, day and night, they're discussing the question, why not this? Why this is the answer? Why not this? Why this? So they are gaining knowledge every day. We have an active group for that, preparation group, okay? So when you discuss, you will learn. If you only read alone, you will not learn. Because learning has 3 phases, you all know. Number 1 is reading, okay? Number 2 is discussing, and then writing. Reading, discussing, and then writing. So there are 3 phases. 3 phases of memorize a question. First, you will read the question, then you will discuss the question, then you will write something. And then after a few days, you will revise. That makes 95% memory of any question. Okay? So when you discuss, definitely when you speak to someone, when you teach someone, you will retain that information for a long time. Okay? So these are the same cases book, task cases book, 50 cases book, Science of Pediatrics book, Ethics, Palliative, Pharma, basic subject means what? Basic subject means there will be question from what? Histopathology, pathology, microbiology, immunology, biochemistry, even physiology. You got my point? But microbiology, histopathology, immunology, these are 3 most important. Physiology, biochemistry, pathology, not so important, but histopathology, microbiology, and immunology, this three has the most important value for exam. Okay. Now, sample paper you already know, recall you know, statistics. Now, this is a very, very terrifying things for many students, right? They cry like that. I cried, literally I cried when I studied statistics. It was horrible for me. But finally, we did it. Finally, we could answer statistics. We knew there are some important topics in statistics that is mandatory, like sensitivity, specificity, positive predictive value, negative predictive value, then data, interpretation of data, visualization of data, then type of the study, qualitative study, quantitative study, trials, clinical trials, randomized control trials, right? So these are the main things which will come in statistics, and Mrcpch has a book called Statistics for Mrcpch. You will find every material here. Where? In this channel, Study Mrcpch, all parts with Dr. Tamanna. This is my Facebook channel. This is my YouTube channel, second one. Okay, Dr. Tamanna, Mrcpch. This is the green pediatric book, green guideline, recent one. Okay, then this is my, sorry, okay, this is my Telegram channel, Mrcpch with Tamanna. Then these are my WhatsApp channels. Okay, there are lots of WhatsApp channels. So in any channel, you will get this material, but mostly I will advise you to join my Telegram. See here in the Telegram, if you search here, see here, media and file. Can you see this arrow? Can you see this arrow, tick mark? Here, if you click media and file, you will find every book. There are how many material? I think 600 or 700 material, all related to Mrcpch. Okay, you will find guidelines, you will find task cases book, FOP cases book, every material. Just you have to search for 1 or 2 hours. You will find every material you need. Okay, these are the channels you can join and you can get free help. I don't charge anything for that. Okay, just you keep praying for us, all of us, and you keep studying. Okay, you do shine in your life. This is our motto. In my course, personal course, I coach the students personally. Each and every student I take daily feedback. How about your study? What are you doing nowadays? What study you did? So this is daily feedback I take from them. This is one-to-one study. Okay, you take the classes, you join my batch, you discuss with my batch. I gave you material, books, notes, everything in a package. Okay, I have all the types of course, part 1, part 2, AKP, FOPTAS, and also DCH. So I already started this January batch. I finished it. There is now, my batch is preparing for October exam, next October exam. And then someone is preparing for February exam. Okay, I take... sorry for that. Okay, after the ending of the course, we do the recall class. We do the last recall class, last exam recall. We discuss the recall. Okay. And then, okay, and then we do the mock test. At the last, we do the mock test. Right? So the mock test is just like real exam. This is the structure of my course. Okay, now this is the time for question and answer session. Please, anyone has any question, you can ask me. Don't hesitate, okay? You can ask me. Anyone has any question? Because we finished all the related questions that is important for Mrcpch. You can ask me anything related to books, related to preparation.
Past test, doctor.
Past test, okay, very good question. Past test, we give in our groups, we give in our students, but I told you already that past test is for a practice one time, not mandatory, because the question will not come from past test. Question will come from books. Okay, you got my point? You can buy it. Past test, you can buy it. Past test, you can buy it from online past test, okay? But it is not mandatory. Someone is asking this slide someone is asking, I think.
Okay, thank you, Ma, for this wonderful lucid lecture. I want to ask this question. Sorry, I joined midway to the lecture, okay. But I want to know what's actually the qualification for this Mrcpch exam? What does it take? Yes.
Yeah, that's a very important question. So qualification is MBBS, that is Bachelor of Medicine and Bachelor of Surgery, from graduate from medical college. That is your qualification. No need of any English testing. Okay.
Okay, thank you. All right.
Yeah. Okay. How can
then,
we
sorry, Ma.
Yeah, please go on.
Okay, then after assuming you qualified, you passed the 2 exams. So does it mean that you have remedied the English test, or you're still going to take the English test?
No. English test is after the clinical. It is opposite of PLAB. In PLAB, before PLAB, you have to pass English test. But in Mrcpch, after clinical, you have to pass English testing. So this is opposite.
Okay. All right.
Okay.
Thank you for.
Thank you. Welcome. Anyone? Yes, Dr. Aisha, you have some question. Dr. Chaidi, Easy, you have some question?
Okay, I'm the one that just asked.
Okay, anyone has any more question? I can see some hands are raised.
Yeah, ma'am, I want to know one thing.
Yeah.
If we clear FOP, we can go for DCH clinical.
Aiva, good, yes.
And then if we clear all of them, we can go for Mrcpch clinical as well. So we get 2 degrees, right? DCH clinical,
Yes.
I mean DCH and Mrcpch both.
Yes, correct. You will get 2 degrees if you pass all those exams.
Great. Thank you so much, ma'am.
Okay, welcome. Do you have any advantage if you started residency training? Definitely. You have advantage. I came to Mrcpch after completion of postgraduate degree in my country. And that is the reason I am here today. You are here listening to me because I am very much experienced, right? So when you take training from your country and then give Mrcpch, you will be that much experienced. Okay, Dr. Tamanna, please tell me importance of essential revision notes. Not at all important. Please discard this book. Gift it to someone who is non-medical because essential revision notes is now obsolete. Okay, Dr. No-Shu C asking me, what are the books for CNS, CVS? Yeah. The books I already told you, doctor. The task cases book, Science of Pediatrics. I already told you, this is a systematic books. You have all the system here, all. Like CNS, CVS, everything here. Okay. And for FOP exam, it is a guideline-based exam. So you have to read guideline book, okay? Like FOP and neonatal guideline, like CNS guideline, CVS guideline, okay? From here. So CNS and CVS both are different in FOP and TAS. For FOP, you will read guideline, you will read survival, you will read illustrated. But for TAS, you have to read Science of Pediatrics. Got my point? That is the book for CNS, CVS, everything. Okay, someone is asking, ma'am, can you repeat how to verify Mrcpch account? Okay, I will do what? I will post this video to my YouTube so that you can repeat this again and again, okay? Will that be helpful? Okay. Okay then. Any more question? How can we join Telegram group? Yeah, Telegram group, I will post the link. Just message me personally or in the group. I'll post the link to you. Not an issue. But in some country, Telegram is banned, huh? Telegram is banned in some country. For them, I can't help actually. How long could you wait to write AKP? There is no waiting time for AKP part 1. Just book exam and give exam. If you are prepared, there is no waiting time. Okay. Any more question? Yeah, doctors from Nigeria, you arranged the meeting, so please ask me anything. Yes. Sorry, doctors, I can't hear you, doctor. Last slide is this one. This one you wanted, or this one? Which one? I don't understand. This one or this one?
Can I see your last slide? Just keep going.
Doctor, your voice is breaking. I'm sorry. I can't hear you properly. Can you type in the chat? Okay. So, Dr. Chedi, easy. Any question you have more, or from behalf of your group, on behalf of your group?
Okay, thank you very much. We are happy, and we are more knowledgeable about the exam. Most of us that joined the meeting, we are already in training in Nigeria, and part of why we are thinking about this exam is to have a degree that is representative. Yeah. Our question is: Are there passing the Mrcpch? Are there extra benefits in the UK? Are you going to be starting at the same level as someone that passed PLAB? Yes, ma'am.
Yeah, that is a very good question. Practical question. That what is the benefit of Mrcpch over PLAB, right? Is this your question?
Yes, ma'am.
Okay. So PLAB, as I said, PLAB is a medical officer level exam. Medical officer, you are a SHO, okay? Senior house officer. But Mrcpch is a registrar level exam. You are a registrar. You will directly go ST3, ST4, ST5. Okay. But PLAB, you will go to the SHO level. After passing PLAB, you will pass part 1. You will take training, that is 8 years. Pass part 2, pass part 3, Mrcpch, then you can become the consultant. But if you start Mrcpch in your home country, pass all the parts, then go to UK, you will be directed to the ST4, ST3, and then after 3 or 4 years, you will become the consultant. This is the pathway, CCT. But there are some alternate pathway. Like for myself, you can ask me which pathway I am in. I am directly on the Caesar route. I will not go to the CCT route because I'm already very much senior. I will not take any more training. I am already trained up. So for me, it is different pathway, like very senior doctors, already consultant. For them, they will take the Caesar route. No training required. You will just deposit the paperwork and just become the consultant. Okay, but that is very, I don't like this. I don't like this because you need some training in UK. But if you are very old enough, you don't have that much energy, you can go to the Caesar route. That is different discussion. We will not go. But yes, for you, after Mrcpch, definitely you will become the registrar. Okay? Is
yes,
that your answer? Okay. Dr. Hanadi Muhammad is asking, what is the basic science book? Read basic science. Yeah, basic topic are present in science of pediatrics, most of the basic topic. But in my classes, I used to make notes for pharma, for physiology, for microbiology. I used to make notes. I used to give them because, you know, whenever you are under a teacher, you are under an umbrella, you will give some protection, right? They will give some protection. So you can read this from the Science of Pediatrics book. There are microbiology, there are pathology, okay, there are embryology. Okay, is that answer your question? Yeah, Dr. Oba is very good question asking. It appears Nelson Pediatrics is not emphasized in the UK. Very good. Nelson Pediatrics is not a UK based book, as it is a international American USA based book. It is not a UK based book. That's why we don't read Nelson in this Mrcpch or UK. UK, they follow guideline, you know, this UK, the people are always follow guideline. Okay, you cannot do anything without their BNF, that is National Pharmacopoeia. You cannot give any drug without BNF. You cannot give any treatment without guideline. So they are mainly guideline based. Okay. Okay, thank you very much. They said, okay, that is okay. Yeah. Okay. Yeah. Hello, yes.
Sorry, I noticed you kept talking about your classes and your tutorials.
Yes.
So how do we enroll in your classes or your tutorials if you're interested?
Yeah, please. For that, you have to contact me personally on WhatsApp.
Okay.
Okay. And even without my classes, I will suggest you, please see my channels. These are free, like Telegram, YouTube. These are free. So you can go. There are, 260 videos. Just go to my video section, click Mrcpch part 1, guideline, click ethics, click palliative, everything will come. Everything one by one will come. Okay? Wow. These are the channels. Yeah.
Good evening, ma'am.
Yes.
Good evening, ma'am.
Yes.
Thanks for this wonderful lecture, ma'am. Please, I just want to make a clarification. I have a friend there that really told me that to be a consultant in pediatrics consultant is not gainful. I'm sorry to use that word. That since government fund most of the cases, in terms of care of children over there, that most people do divert to family physician. So I want to ask: Is that really true? As a consultant pediatrician, are they the least paid consultant in UK? Just a clarification. Thank you.
Yeah, no. Actually, in UK, consultants are highly paid. Okay, consultants are highly paid. Okay, so whenever you join pediatrics training, you become consultant after a few years, you will be highly paid. Even you can do private practice if you take permission from the government. And earning money is different. Like after become consultant in UK, you can move to Australia, you can move to USA, you can move to Canada, you can move to Gulf countries. So earning money and gaining knowledge is different. You can earn money as much as you want if you have that much energy. Okay, is that your answer?
Yes, thank you, ma'am.
Yes. Okay, thank you. So I got all of your question. I answered many questions. What no, please? What no? Oh, my number? You want my number, right? This is my number, WhatsApp. 0171 4455 This is my number. Okay, any more question? I can take few question more. I have 6 minutes still to go to work. 6 minutes. Any more question? Okay, then I guess it is finished today. So thank you very much, doctors from Nigeria, to arrange this session, and all who joined from different countries. And we will soon meet with some topic discussion, like maybe CNS, maybe CVS. Okay, then. Thank you, Dr. Easy. Thank you very much. Thank you. See you.
Thank you very much, ma'am.
Thank you.
Thank you so much.